Hi, my name is Saif. I'm a first year medical student at the University of Sunderland. In this video I'm going to talk about why you don't necessarily need an iPad at medical school and sort of compare whether or not you should probably get an iPad or a laptop for medical school. Personally, I've sort of dabbled with both and I thought it'd be handy to give my opinion having used them as well. I guess a good starting point is thinking about the types of teaching at your medical school. We have PBL, lectures, clinical skills, communication skills and anatomy. With lectures I found it more helpful to use my laptop given that I can type quicker than I can write. And I didn't necessarily think it was that important to annotate things in the lectures anyway, like on the screen. I think it was something that seemed exciting before I got my iPad, but then once I did, I found that I didn't really use it. But yeah, so making lecture notes, I'm pretty much just writing things down that weren't on the lecture slides, but that the lecturer said. So that was quite handy. And I guess, of course, if I was using an iPad, I might not have been able to keep up with that pace. Outside of lectures and thinking about something such as anatomy, I found that I did use my iPad a bit more than my laptop, because in my medical school in particular, we were told to come with a device that we could access a software called Complete Anatomy. And of course, with my iPad being a lot more compact and mobile, I brought that instead. But again, I've seen people come in with laptops, so you don't necessarily need an iPad, you can use a laptop, and I guess it's just down to preference. One thing that I think is interesting is that a lot of medical students, if not most, use particular things such as Anki or Quizlet to make their sort of flashcard notes. And of course you can input these through either iPads or laptops, so it's not that significant whether or not you have one or the other device. I guess a particular place where having an iPad over a laptop would be better is like clinical skills and communication skills. But again, I don't think I saw anyone pull out devices during these sessions, though I probably saw more pulling out pens and paper to just sort of jot down patient information that they could sort of get rid of afterwards. And I guess if you're using a device, it kind of looks less personal and it just looks like you're there to note take rather than speak to the person. And obviously using a laptop or an iPad isn't also the be all and end all. You can use just pens and paper, which I've seen people do successfully at uni as well. Not only is that cheaper, but I mean, it's pretty much the equivalent of using an iPad. The only sort of downfall is that you have to sort of manually store everything and source your information, whereas on an iPad it's a lot more easier to do that. If you're using a laptop, you don't necessarily need any particular software. You're good with something such as like Microsoft Word, Microsoft PowerPoint to do your like essays, for example, or to annotate your PowerPoints. And in addition to that, you might just want to download something like Anki and also the Complete Anatomy software or whatever software your university gives to you. With the iPad, it's good to have a note-taking app such as GoodNote or Notability. I personally use GoodNote, but I say that loosely because I don't really use my iPad that much. But I believe both apps are equally as good as each other. It's just down to whether or not you get one or the other. But having done my first year of medicine, I give more consideration into how I'm going to sort of note take at medical school. So far, I'm still set with, in lectures, using my laptop to sort of annotate things in the comments box, just to make sure that I've got all the information given. But I don't want to make very comprehensive notes because I want to listen to the lecture rather than just sort of spill out everything they've just said back at me. That way I can actually process the information in the lecture a bit better, rather than making a transcript of what the lecturer's basically just said. When it comes to things such as anatomy, communication skills and clinical skills, then I'd probably more use my iPad because it's a bit more convenient than carrying a laptop around. That being said, you don't really need to revise from that information, you just use resources given to you. The things that you sort of get from communication and clinical skills are like mock scenarios from patients. So that covers lectures, things like anatomy, clinical skills and communication skills. In terms of sort of revising for exams, again, I don't think it matters whether or not I use something like my iPad or my laptop to throw things into Anki, but the most important thing is actually using some sort of like active recall software. I didn't particularly make very good use of Anki last year, and I'm hoping to make more use of that this year as well. And in a future video, I'll talk about sort of using Anki to make my notes as well. I hope this video has been insightful in sort of describing the technology that I used at medical school, and I hope it allows you to make an informed decision on what you might bring. Thank you.